digital technologies could be that a dentist will not be allowed to do digital design of dentures and all of that. Is still the work of a technologist to do it. And again, we are going to look at some videos here. We are talking so much about theories on around how to do this work, but what about the practical aspect of doing it? Doing a digital denture production, for instance, doesn't just begin and end with the 3D printing. Okay, even after it has been printed, there is still some work that needs to be done, which is still a dental technologist that has the right training to do those jobs. Do you understand? So I don't think that it will eliminate the work of the dental technologist completely. The dental technologist will always be useful, but it might have an impact on the number of dental technologists that might be required per laboratory to function. Do you understand? Like, I have worked in federal medical centers in Nigeria, where if you come to the dental technology lab, you have so many people, you know, the lab is so large and they have so many hands-on interns, people doing NYSC, people that are permanent staff and all of that. There could be 15, 20 of them working, and they are quite busy. Now, if they go fully digital, they may not need all of those people, because things now become the work process becomes so much streamlined that they may not need all of those people coming in. So these are some of the things that we fear in terms of the future. I'm not sure if I saw another hand up, but let's crack on and look at some of this the future here. Messi. Okay. Yes. Exactly. Thank you. I like your contribution. Your contribution is top notch. So what you've said is really, really applaudable. So dental technology is definitely going to change. We will get there when all labs will go digital. Like you used computer as an example, there used to be a time when for you to be able to do anything computer wise, you need to go to a specific place they call cyber cafe. That's the only place you go, you find computers and people pay for time and use computer and leave. There is a time, at this time, you are doing this is something you would have gone to a cyber cafe to do, but now you are doing it with your mobile phone in your palm. Some of you are, you could be doing it lying down in your bed, in your office, in the clinic, wherever you are. You have that portable devices, and it's now affordable. Everybody have, it's almost everybody. So many people now have smartphones because it is affordable. If you think about the cost of a laptop, when laptops came out, if it was costing ridiculous amount of money. Many people didn't think they would ever be able to buy a laptop, but when the technology improved, it was now people, they are now able to mass produce it to a point where almost everybody can afford one. Not everybody, but it's a good number of people who need it. If you truly need a laptop now, you can afford it somehow. So that is the direction that these things will go. So just to summarize this conversation around the future of digital dentistry, digital dentistry in relation to dental technology, let's say that the trajectory of digital dentistry suggests that there are rapid and continuous evolution. So this evolution we are talking about is not stopping. Okay, it's rapid. It has been a sustained evolution. We are going to quickly look at, when we go onto the other topic, we will look at what do you call it, the history. Just like you just started talking about the history of dentistry. We'll look at the history of dental technology and see the materials that were used many years ago, where this thing started, how people restored their tooth in the past, until what we are having now as the current practice in many places, and now we are going digital. We are going to try to trace the history a bit more and see where we are going in a full production, where we are heading towards production of digital dentures. Okay, so we say that there are several emerging trends which will shape the future of digital dentistry. One of them is artificial intelligence integration. At a point, artificial intelligence will be integrated into so many things that we have. Our phones now have some form of artificial intelligence. If you go on Facebook now, you see some artificial intelligence integrated. If you open your Google, you see some integration. There is Microsoft Copilot now that is being developed. Again, that is artificial intelligence. It will come to a point where artificial intelligence will be integrated into every aspect of dental practice, and then that will become a norm at a point. And AI will become more embedded in diagnostic equipment. In fact, in my program in Cambridge 2 days ago, we were talking about modernization of dental tools, and one of our colleagues had just produced and patented a dental pen, okay, that is used to mark out the surgical areas instead of using normal pen that they use currently. And that is something that is a bit smart that is doing now. Those pens can be integrated with artificial intelligence and also some smart devices within that pen, that you can actually draw and electronically record what the drawing that you are making within the oral cavity, and that can actually be a really, really good thing. So that is predictive analytics and will personalize care based on patient specific data. So once we do this, we can be able to use artificial intelligence to predictively personalize the care based on patient specific data. So these are some of the things that we anticipate for the future of digital dentistry. There could be cloud-based workflow. Okay, cloud-based workflow. Now, and one thing I was thinking about when we were talking about this, what will happen in different places, and I started seeing a situation where in the future we could have practice integration, where so many practices can be integrated or bought over by one large conglomerate, who will now say, okay, we have a central laboratory where we can actually send our work, but all of these small practices will now be integrated into that place, so that all the jobs that are collected from different clinics are sent to this central laboratory, where it will be milled and 3D printed and then returned to the specific laboratories for the finishing and delivery to the patient. So those things can be actually possible, and they will work better if we have cloud-based workflow. Okay, so when we use cloud-based workflow, what do we expect? We expect that the cloud platform will enable real-time collaboration among dental teams. That's what I'm saying. There will be real-time collaboration. There could be real-time collaboration between a practitioner in Kampala with a practitioner in Abuja, Nigeria, because everything is cloud-based. You could share files and dental files between yourselves and upload things and have over a meeting, Zoom meeting like we are doing now. You can actually do that in your dental practice if you are both operating cloud-based practice, and your workflow can also be integrated in the future. The labs and the specialists, and there will be a lot of streamlining of workflow. All the unnecessary forth and backs will be perhaps completely eliminated in digital dental practice. And then there is what we call augmented realities and visual realities. I don't know how many of you that have ever tried out putting those massive goggles in your on your head, covering your eyes, that makes you begin to see yourself in a different place, and you begin to think that what you are seeing is real. I've seen on social media where people are jumping off from things because they felt something is chasing them when they're actually in their living room. Why? Because they're using visual realities and all of that. And these things can also be integrated into our dental practices, into our dental laboratories, and even in the dental schools. Students can actually use augmented reality to learn how to work in a dental laboratory, and things will feel as real as it could be. Okay, so these augmented realities and visual realities are pieced to enhance dental education. I've said that, patient engagement and sufficient simulation. So you can actually use augmented reality for a patient to make the patient see themselves after, see the after of the treatment. Even before that happens, they can actually see into the future of that. There is no limit to what you can achieve with these augmented and visual realities. Then we're talking about smart dental devices. I did mention about this fellow student who actually manufactured this device that is used to draw inside the mouth. No, those things can actually, maybe the next version of it could be made to become a smart device, where while you're drawing it, it can be recorded on the screen or recorded somewhere else, and you can actually see it, or someone else can see it, or someone can remotely be drawing inside the patient mouth. There's no limit to what these smart devices can actually help us achieve. There could be connected devices with IoT integrations, which may track oral health metrics and alert dentists or the patient in real time. Imagine if you had fabricated some orthodontic appliances for a patient, and they have some smart devices incorporated into those appliances, and the the dentist can actually monitor in real time the tooth movement when those appliances are actually attached with those level of smartness that could be incorporated into them in the future. So this might sound like hallucinations at the moment, but every science fiction, every reality that we have now, every scientific achievement we have now, all started with science fiction and things that seemed as though they were hallucinations at the time when the people involved were expressing them. So researchers might also be exploring 3D bioprinting of dental tissues, potentially enabling regenerative treatment for teeth and gum. I did listen to a professor who was talking about natural regeneration of the teeth. So it might come to a point where we may not even need to do fillings anymore. So we might be able to have those nanotechnology that can actually be able to cause a broken teeth to repair itself, or even cause a tooth that has fallen out to actually regrow again. Then that's actually when I will know that dental technology might be phased out, if we are able to regrow our teeth without having to replace it artificially. Okay, now these things sound like hallucinations, but if you hang around, any one of you that is willing to hang around this earth for the next 50 to 100 years, you might experience these things that we are hallucinating about today. Okay, so these are some of the things that we expect could be the direction of digital dentistry in the nearest future. So we shall now look at the digital workflow in complete denture production. Okay, so we look at the digital workflow in complete denture production. So if you look at the picture